Brilliant. Oh, thank you so much, Meg. And I think Julian's not on the call anymore, but I'd also like to really thank him for his kind words. And it's such a pleasure to be here. And honestly, you don't need to thank me for anything. I thank you for inviting me to this wonderful event and for all of the work that all of you have been doing to keep one another safe, protected, mentally well over this extremely challenging period. And I just want to say that Peer Talk, really, you had me at hello because I understand through my sort of just like generally living life as a person, but through my medical work and now in my role as the Shadow Minister for Mental Health, I have seen throughout my life, and I see now more than ever, how important it is that we are able to work through our challenges with mental health through people that really understand it. There is nothing quite the same as being able to have a completely judgment-free conversation with someone that just gets it. And as someone who has needed to have support for childhood trauma and things in my life, I know the difference it makes to have someone that really understands, because actually they can come to you from a place of a lived experience themselves that brings a different level of support. And I am not surprised that all your research shows the value of peer support, and I think it's absolutely brilliant. And I know that so many of you on this call will have changed lives for the better, so that's just incredible. And I think, asked to reflect on the pandemic, I think suffice to say that there isn't a single group of people that hasn't suffered in some way, shape or form. We know all the reports. We know that, the Centre for Mental Health produced a report last September that said up to 10 million people would need, mental health support as a result of the pandemic. Yes, but actually, whether you are a new mum or dad who has felt incredibly isolated with a baby who's not been able to meet their family, feeling that all of the normal peer support groups that you have as a new parent, which I understand well how vital they are, that they're not available to you, and as a result you're suffering with postnatal depression. That is a very real thing. If you are a child under 2 who is not able to have normal interactions with other toddlers and learn how to interact and share and all of those things, that will go on to have a negative impact. If you are one of our vulnerable elderly and you are living alone and you are lonely, if you suffer with dementia, if you live in a care home and you've not been able to see your loved ones for a year, if you are a carer for someone in a care home or someone who is suffering and you've not been able to see them, your mental health is adversely affected, and everything in between. So as far as I'm concerned, there isn't a single age group, there isn't a single group of people who isn't looking at having their mental health adversely affected as a result of the pandemic. In between all of that, you have primary school children, you have teachers, you have secondary school children, you have children who live through the exams fiasco and are feeling that that their definition of self is all based on their exam results for maths and English and science, and that actually being happy isn't the most important thing, their results are the most important thing, and that's how they're defined. If you're a university student and you found yourself blamed for the second wave of the pandemic, or living in halls having left home for the first time but unable to leave your halls of residence because you have to self-isolate and you're living with strangers, your mental health would be adversely affected. And then we know all of the things surrounding stigma that leads to greater rates of people trying to take their own life. We know that adverse childhood experiences mean that you are more likely to suffer with your mental health. We know that inequalities means that you're more likely to suffer with your mental health. So there isn't anyone who is protected in any way, really, from the pandemic not potentially adversely affecting their mental health. And then you take people who, this might be the first time they've ever struggled with their mental health. They've lost their job, they don't know how to put food on the table or a roof over their head for their children. And I always say, regardless of how much money somebody has, how big their house is, how they vote, mental ill health can affect everyone. And mental health shouldn't be a political football. It really shouldn't. You know, and it's really good to hear, you know, cross-party support. And actually, you know, Julian, when he was working for Theresa May, she made a real effort to talk about parity of esteem between mental and physical health, and that's really important. And I think that was probably the first time I really remember hearing a politician in the public eye that with that high office talking about mental health. And unfortunately now we don't have the resources that we need, and that is why more than ever peer talk, offering peer support, is crucial. We know it works, we know it's needed, we know it's going to be needed more than ever. And I will be very happy to fly the flag for, you know, supporting all of your endeavours, because it's not easy. It really isn't easy at the moment. And for many people, their mental health is struggling because they feel so isolated. And we've got to remember as well, all of the people that were struggling with their mental health before the pandemic. You know, we cannot leave behind people who were suffering with their mental health beforehand. And we actually know that our services, you know, weren't properly resourced even before the pandemic. So the challenge is now, how do we bring people like yourselves and peer talk into a system to help relieve some of the pressure that's there in an evidence-based way that makes sense, but also provides people an opportunity to feel a bit safer? It can feel really daunting, to admit to yourself that you have a problem with your mental health, that you just don't feel okay. We know that part of the issue is stigma, which stops people talking about it. So just having someone that you can go to and talk to in a way that is absolutely non-judgmental, and you can talk about your feelings and know that the other person may well have lived through that themselves, is crucial. It is absolutely crucial. And I think another thing that I've seen in the pandemic, which I'm hearing about more and more, and this is, you know, anecdotal, but I'm hearing it when I see patients coming into the A&E, and I'm seeing it particularly with younger and younger people, is that sense of guilt. People saying, I haven't lost anyone to COVID, I haven't lost my job, but I feel really down, I feel really depressed, I feel really anxious, but I feel guilty about it because I know people have lost everything and I haven't lost everything, but I still feel awful about myself and my life, and I don't know what to do. And I think that's where peer talk is really important, and we have a real collective responsibility together to promote the message and the understanding that anyone can suffer with their mental health. It has to be a judgment-free zone, and there have to be safe spaces for people to feel that they can talk about how they feel in a really honest and open way, and that everyone is welcome, and that it doesn't have to be about the scale of how awful your life is or isn't compared to somebody else. It's simply that you want to feel better, you don't feel okay, and you've got someone that you can go to and say, I don't feel okay, can you help me? And so I'm here for it. I'm here for the journey. I'm really excited to be part of the conversation today. And I'm just so honoured that you invited me. I mean, I really am. And I'm a huge fan, and I hope this is the start of a fantastic working relationship together. Thank you so much.